Hi guys, my name is Lissandra and I'm a physio here at Fine Form. This month I'm presenting the new topic called Patella Femoral pain. It's one of the most common causes of knee pain in the entire population, and what actually happens is the patella here, as you can see behind the quadricep, and the femur, so your thigh bone here, rub together and the joint becomes irritated, and it commonly presents with pain behind the kneecap itself. Okay? There are two main causes of this issue. So you've got a muscle imbalance between the inside and the outside of your knee, which causes the patella to track on the outside of the joint and rub against the bone. And then there are other causes such as biomechanical reasons. So you've got problems with the hip as well as flat feet. Okay? I'll show you an example of the muscle imbalance here on the poster. So if you have a look, the inside of the leg here is obviously a lot weaker than the outside of the leg here due to the muscle imbalances. Okay? And the patella tracks on the outside there and rubs up and down on the bone. Okay, so that's a really common cause there. We're actually going to show you how to fix that cause today with our model. Okay, and as I explained earlier, there are two causes of this patella femoral pain. The biomechanical treatment focuses that we can really work on, I guess, are fixing the cause of the flat feet. So whether that be orthotics or strengthening, we can work on both, as well as strengthening of the hip muscles and getting that motor control nice and strong. Okay. Today we're actually going to focus on the alignment of the kneecap. Okay guys, so as you can see we have a patient's knee here. The patella, as you can tell, is actually quite towards the outside of the joint. So if you zoom in here for me, Mitch, you can see the patella pushing towards the outside of the joint there. It should be further in towards the middle, okay? So it's tracking inside that groove up and down nice and smoothly rather than rubbing on the outside there, as you can see, okay? So we're going to fix that problem at the moment using dynamic kinesio tape. Okay, so the purpose of the tape is to hold the patella in the correct position. Okay, so you put down the anchor through here, ensure that you've got the tape measured out ready to go. Okay, first strap comes across, we hold the kneecap in the correct position. Okay, follow around and then relax that tape through there. Okay, same thing comes across with the bottom, holding the kneecap in the right position, come around underneath, make sure that that sticks down, and then relax. So as you can see here, we've got a little bit of bunching through the outside of the joint line, and the patella is sitting right on the middle here. Okay, so we don't have that positional fault anymore. So when Susie bends her knee, she should feel no pain. How do you feel there, Susie? Great. Pretty good. Okay. So now that we've got the kneecap positioned correctly and it's not rubbing on the outside of the joint there, we've got what's called an electrical stimulation machine, which basically vibrates the muscle with an electrical current and makes it turn on. So we're actually making that motor control of the knee a lot more stronger and allowing that kneecap to move in the right position and encourage that correct movement pattern. So as you can see, when Susie pushes down, we get an increased uptake of that muscle there, okay, and relax nice and slowly. Okay. So as we mentioned earlier, another form of treatment for patella femoral pain syndrome includes the use of orthotics. So instead of being in this internally rotated position where the patella is now sitting very far out towards the outside of the joint and begins to rub, we stand in a nice position like so. Okay, so here at Fine Form Physio we have a gait scan piece of technology which actually analyzes the way your foot and your leg moves. Okay. And the end result, as you can see, is a custom-made orthotic. Okay, so that holds the foot and knee in the correct position. So I'll just show you the effect of that. Okay, as you can see here, the arch of my foot is nice and stable and high, and it avoids any excess movement towards the inside like so. And we keep the knee in a nice stable position throughout our daily activities of living. Thanks for tuning in this month, guys. Look forward to seeing you soon in the clinic. All the best.